challenges in those days were trying to recruit people to come here.
One of the problems of recruitment, of course, is that for the first year we had no hospital. The hospital opened in 1970. I came in 1969. To recruit clinical faculty when there was no hospital was always a question mark.
When I arrived here, the west part of the Crescent was still under construction. And we set up shop in the farmhouse across the way, which is now the Cocoa Beanery. The kitchen of the house was actually set up as a laboratory, and that's where research was done for the first several months of the existence of the medical center.
The minute we invited some outstanding young professor from a place like Duke, suddenly that assistant professor would get promoted to. So we were responsible for more promotions in academic medical centers than we were, recruiting.
I think that we did fairly well.
I hear stories from people like Graham Jeffries, who George Harrell recruited here, that the only reason he remained in George Harrell's pile of potential applicants is because he was under 40 years old.
He wanted people to come here who were full of fire and young and wanted to build.
It takes a certain amount of chutzpah to select people based on their potential rather than their proven track record.
I made it by the skin of my teeth.
And one of the things was very important to him were who the wives were of the chairs.
I think his view was that if you related well to your support, you were going to relate well with other people.